So today we're going to do a little bit on anatomy. It's quite content heavy. The nice thing about anatomy is anatomy doesn't change. So it's just fact. You go back to anatomy, it's the same. You can't change it. It's what makes us so good at what we do as physios, is we know our anatomy really well. So always go back to anatomy. I always show anatomy videos and pictures to my patients. It helps them to understand. It's your number one educational tool. So we're going to talk about the bony pelvis, the joints, the ligaments. We're going to spend a bit of time on non-pelvic muscles. Then we're going to focus on pelvic muscles. Then we're going to go into pelvic nerves and teach you a little bit about the prostate, the penis, the scrotum. And then I've added in the physiology of an erection and pathway of sperm, because I think those two are very important, especially when it comes to conditions that we treat. So you do need to know those, because your patients will ask you. Right, so like I said, this is content heavy. We're going to get to a section just now where we will talk about anatomy. You shouldn't have to take notes or anything like that. There are a few anatomy pictures without descriptions. Those are the ones I just want you to have a background about. I have a detailed write-out of that, which I can send to Craig, and Craig can send it on to you as a resource. But don't make notes. I want you to listen and absorb. That's all I want. Right, so the male pelvis contains a complicated mix of muscles, fascia, ligaments, blood vessels, organs, and nerves. The pelvic floor muscles form part of the pelvic floor, and they are responsible for the maintenance of continence, sexual function, and pelvic organ support. All right, so we all know that we've got a pair of ilium or iliac bones on the pelvis. We've got the sacrum in the middle, the coccyx or the tailbone at the bottom of the sacrum, and then a pair of pubic bones. And then very importantly, the X in the center marks the pelvic outlet, which is really important when it comes to muscles that actually sit in that pelvic outlet like a hammock. So we're going to do a little bit of a video for you, so sit back and just listen up.